Welcome back to the Doc and Diana Show. I am Doc.
And I'm Diana.
And we're back talking more about my favorite topic, cardiovascular disease.
Yes.
We talked a little bit about the measuring cardiovascular disease risk based on risk factors versus actually measuring cardiovascular disease
process.
in our last video. And so I thought we would talk a little bit about some of the tests that we're going to use in the introductory panel.
Okay.
That's my thought.
All right. So what, as a patient coming in to do that entry-level program, what are you testing for? What are you looking at? What are we talking about today?
Yeah, so the first thing, when you look at cardiovascular disease, it starts with endothelial dysfunction. Now, we've had videos about that. I've put stuff on the website about that. Endothelial dysfunction is the very first thing that shows up. Now, there is some data that the endothelial glycocalyx may actually be the first thing, but there's no way to clinically measure that, and it's really more about protecting the endothelium than it being part of the disease process itself. Think about a force field. You know, when you go around playing guns as kids, and you're like, can't get me, I got a force field. That's what the endothelial glycocalyx is.
You cheated. If that's what
Why?
you did, that's cheating.
You weren't using force fields?
No, I played fair.
You weren't playing hard enough.
Okay, so let's get back to the endothelial dysfunction measurement here.
So there's not a way to measure endothelial glycocalyx. So endothelial dysfunction is the first thing that will show up when there is the very, very beginnings of cardiovascular disease, even way before there's any disease itself.
Okay, so it's a big fancy word. And then remind us real fast, what are some things that I, in everyday life, might experience that would be like a light bulb going off of, oh, I may have endothelial dysfunction?
Well, the first thing that I would say is primarily for men, and it's erectile dysfunction.
So ED causes ED.
Correct. If you have erectile dysfunction, you can almost guarantee that you have endothelial dysfunction. And, it's the scope of another video to go into the associations with what it is and all of those kinds of things. But the endothelium is the lining of the artery. And again, I've talked about this in other videos.
Yeah, just quick.
But it controls that artery. It controls what happens in the wall of the artery, and it controls what the artery does. So does the artery expand or contract?
Yeah.
So when, for an erection, you need to dilate the blood vessels for the blood going in and constrict the blood vessels coming out.
Got it.
That's what causes the distension, and the corpus cavernosum and the corpus spongiosum fill and distend with blood.
Lovely big words.
Right.
So that's going to be some things that I might pick up on, as a male. Anything females? Anything kind of standing out?
Well, certainly, I think it would show up later for women, but things like Raynaud's phenomena, where your fingertips get blue, there's a circulatory problem there.
Okay.
There's some question about things like pregnancy-induced hypertension, preeclampsia, those kinds of things.
Really?
Yeah, there's some endothelial dysfunction going on with those things.
Interesting.
There is some endothelial dysfunction association with what's called Prinzmetal's angina. So that's where I've seen patients like this. They had coronary vasospasm. So the blood flow to the heart, the coronary vessels, will actually constrict to the point that it slows blood flow through it so much that they're not getting enough. They'll get chest pain. And then once it relaxes, they go and get a test, and everything's completely normal.
So will it ever show up that, you had an event, or is it just like, nothing's showing, so it must have been? It's almost like a...
There are ways to do that. You can give acetylcholine, you can give nitroglycerin, and you can see some changes in those arteries. But these are in a cath lab kind of things.
Right.
This is not, you're not going to get this test in your doctor's office.
So it's pretty wise to just go ahead and get the screening, because it seems like, especially for females, there's not any kind of specific major thing that's going to catch our attention.
Correct. In the window before we have manifestations.
Which is what I want.
Right. And manifestations would be heart attacks.
Yeah, I don't want to get there.
And hypertension and strokes and all of these kinds of things. So that's the problem with cardiovascular disease. Many people, their first acknowledgement that there's cardiovascular disease is a heart attack. Now, for men, 25% of those heart attacks are fatal. So the first presentation that you have a problem is you're dead. And I want to say for women it's like 40%, but don't quote me on that one. I want to say I read that. I can't remember. I can't quote the source. But it is higher for women. But the percentage, it occurs a little bit less frequently. But when it happens, it's more fatal.
So I'm coming in, and you have a test. You have a thing, a procedure that you can do that's non-invasive and pretty darn quick.
Yeah. So this test, traditionally it was, when we talked about it in the last video, it's called ultrasound flow mediated dilation. You occlude the blood vessel with a blood pressure cuff. And so it doesn't matter how you're measuring this, at least by current, what's out there now. Put a blood pressure cuff on, occlude the blood vessel for 5 minutes.
You're squeezing down.
Whether you're using that ultrasound, which we don't use in the clinic, or you're using something like Endothelics or Endopat, they all work by a similar mechanism.
Okay.
So blood pressure cuff goes on. So basically you come in the clinic, you sit down, you just kind of put your hands, if you're using Endothelics, you have temperature probes on both fingers. And if you're using Endopat, your fingers go into probes. But then the blood pressure cuff goes on. You sit there and standardize or stabilize for about 5 minutes.
Is my arm going to do the tingly go to sleep thing because you're like squeezing?
Once that inflates, yes.
Okay.
So you'll sit there and just stabilize for 5 minutes and you just chill. It's, just relax. You're sitting in a recliner, at least in our clinic. Then the machine automatically takes care of this. The blood pressure cuff inflates above systolic blood pressure. You want to cut off blood flow to the arm.
So it's already squeezing, so it's going to squeeze harder?
No, it wasn't squeezing in the standardization phase.
Okay, gotcha.
It's just there.
You're just chilling.
Right. So once it stabilizes for 5 minutes, then the blood pressure cuff will inflate.
Gotcha.
It goes up above systolic blood pressure so there is no blood flow, and it's going to stay that way for 5 minutes.
Okay, now that's where my hand goes to sleep.
Right. And it can be a little bit uncomfortable, but like by the time it's starting to get a little bit uncomfortable for me, it's done. And the blood cuff, the cuff deflates. You'll see your hand, lots of blood flow go in through there.
Pink.
Exactly.
Okay.
Now what we're looking for is you should get this, if the blood vessel is like this big around and then you occlude it, when you release that and get blood flow back to it, it should dilate up. And you want it to the more it dilates, the healthier that endothelium actually is. So you're measuring that response.
Like a ratio or the actual response?
Yes, the Endothelics uses what's called a vascular reactive index. Endopat uses a I forget the name of it, but it's basically a ratio we want 1.67, which is 67% more dilated than it was at the beginning. Right.
Okay.
And optimal would be like 2.1 or somewhere in there on Endopat. So the more that thing dilates, the more blood flow you're getting, and that lets you know that the endothelium is working very well.
Okay.
And so
you got good rebound.
Exactly.
Okay.
And so if you have good endothelial function, then you should not get cardiovascular disease. You should not get hypertension. You should not have erectile dysfunction. Those kinds of things.
Fingertips won't turn blue.
Exactly. And exercise performance can actually go up because you're getting sufficient blood flow where you need it. There's all kinds of implications. So you want good endothelial function for overall health, cardiovascular health, sexual health, women included. You think about the clitoris and the blood flow to it distends it during arousal, and it's because of the same mechanism. It's blood flow going to it. If you can't get good blood flow there, you can have some sexual dysfunction, you can have an inability to orgasm, those kinds of things. So that's one reason that women need endothelial function as well, independent of cardiovascular disease. There's some good benefits there as well. So endothelial function, everybody needs to have good endothelial function. And if it's not good, we need to intervene right away because that's what's going to prevent cardiovascular disease.
And we have supplements that can help do that.
Absolutely.
Now, would you say it is a stop progression or regression capability? Like, what are we looking at? If I come in and I do have dysfunction, do I have the ability to turn that around, or is my
Yes.
goal to just, okay, let's just stop right here and not progress any further?
Nope, you have the ability to turn it around. You can reverse this process in many cases. There are some patients, usually it's in older age with really sick,
Just because.
severe,
Okay.
severe blood vessels, but usually the blood vessel does not fail to respond to nitric oxide, and that's what nitric oxide is, what maintains endothelial function. That's what you need.
And you've done a video on that, so
Yep.
definitely go back to the library and you can
Right.
find that one.
And so
as
if
well.
you have endothelial dysfunction, the goal is to get your nitric oxide levels up.
Okay.
And so that's going to be our focus. In fact, I think one of our next videos is on some things that we do that slow nitric oxide with gastroesophageal reflux, the
Nice.
PPIs.
Gotcha.
What was I trying to? The omeprazole.
I'm
and
trying.
medications like that. Sorry, I was trying to get it out. Those things can directly inhibit the ability to make nitric oxide.
And how many people are running around on PPIs right now?
Oh,
we'll
it's-
save that. We'll save
yeah,
it. Save it for
yeah.
the next one.
Got it.
Okay, so I'm coming in and I'm getting this. Sometimes you'll hear them say endothelix, endopad. I'm measuring my endothelial function to
Right.
see if there's any dysfunction. What does that report look like? Is it telling me vascular age? Is it like, what does it look like? I didn't rebound. What am I looking at?
It's just telling you, is your endothelium functioning? Is it is your blood vessel dilating like it should? Like I said, there's a on endothelics there's a needle and you're in the red, yellow, or green.
Okay.
And on endopad there's a score.
Okay.
And you want good levels on that. If that's not good, you've got to get in there and start fixing the nitric oxide systems to get good endothelial function.
Is this a result that goes into the Rasmussen?
Or
Or is this just identifying disease?
This is not identifying disease. It is looking at arterial
Health.
endothelial function and health.
Okay.
So if you have, I think that everyone that understands the endothelium, when I say everyone, I mean the scientists and these kinds of things, that understands the endothelium, you cannot get cardiovascular disease if you have a healthy endothelium.
Makes sense.
But if you have an unhealthy endothelium, you can get hypertension and cardiovascular
Oh,
disease and atherosclerosis and plaques and occlusions and heart attacks and strokes and all
And
these
bad
other things.
workouts because you don't have
Right.
the energy.
Exactly. Or peripheral arterial disease and you get claudication and you can't get blood flow to your leg and your your leg turns blue and those kinds of things, which we can also assess that in the clinic and see if you've got any occlusion in those
The
things.
peripheral.
Right.
And we can talk about that one as
Absolutely.
well. So, anything else that you think that we need to know about endothelial dysfunction?
I think everybody needs to get it checked, know where you are. It does fluctuate. So if you took Neo 40, ate lots of nitrates, good leafy greens and things like that,
Spinach.
that will affect your endothelial function for a window, for a period of time after that meal
So
or
should
after
I
that
be
supplement.
fasting to come in to get this?
There are some
Caffeine?
preparatory things.
Does
Yeah,
caffeine?
caffeine can affect it, yes. So there are some preparatory things that you should do in preparation for the test. And we'll put that show link on the show. Put it on the website, those kinds of things.
Okay.
It's pretty simple. But those will affect it. So you can get good endothelial function, you can get bad endothelial function, and it can change in hours.
Wow.
So
All right.
that'd be another thing.
Lots of fun nuggets today. For you to get more information, you can go to revolutionhealth.org. You can look for all the beautiful research and articles written by yours truly. And then, of course, show notes and any of the other information specific to cardiovascular disease is going to be there. Definitely peruse through our video library and get caught up if you're just now, getting in with us over all the other things that we've done over cardiovascular disease to support and get you caught up on what we were discussing today. Subscribe to this channel. Be sure to like it. And then leave us some comments so we kind of have a better understanding of your needs and what you need for, patient education, information, things you're curious about. Tell us if the backdrop works. If Doc needs to change shirts, leave us comments. Let us know. You can reach us at the office at 918-935-3636. And our staff there can also help you if you've got questions about the cardiovascular program and how to get started.
Awesome, guys. Thanks so much for tuning in.
Thanks.